Good to go.
Good afternoon, everyone. Welcome to Jefferson County Health Department Board of Trustees meeting. It is roughly 4 o'clock, June 26, 2025. I'm going to call this meeting to order. Ms. Pinkley, could you please do roll call?
Mr. Fig,
I am here.
Dr. Henry,
Yes.
Ms. Stidham,
Here.
Mr. Deal,
Here.
Ms. Taylor. Yes. Here.
Next on it would be reading of the mission, vision, and purpose. I'm going to ask that Mr. Deal, if you could please do that for me. I know it's kind of ad hoc, but Ms. Henry's on the Zoom, so
Okay,
better if you did it. Thank you.
thank you. The mission of the Jefferson County Health Department is to promote positive health outcomes through delivery of foundational public health services. The vision of the health department is a healthy Jefferson County. And the purpose of the health center, as stated in the revised statutes of Missouri, is that the health department is established, maintained, and operated for the improvement of health of all inhabitants of Jefferson County.
Thank you, Mr. Deal. I appreciate that. And before I continue on, please make sure all your cell phones are muted or off so we don't have any other interruptions. Please, thank you. Next on the agenda is approval of the agenda as presented. Unless there's anybody who would like to make an addendum.
Make a motion to approve the agenda.
Second.
Having first and second, is there any discussion on the matter? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Welcome guests. Thank you for being here. Next on the agenda, of course, is the approval of the May 22nd, 2025 meeting minutes. Do I have a motion?
Make a motion to approve the May 22nd, 2025 meeting minutes.
I have a second.
Second.
Having first and second, is there any discussion on the matter? Yes, ma'am.
Got a couple questions. I don't know if I need to ask for an addendum or if it will just be as is and then change, or it would reflect in the next minutes for this meeting. Can I just make my couple comments and then?
Yeah, we'll shoot.
So I wanted to, it's not, well, these aren't numbered. It's on the minutes where it says I stated that I think more of a health officer as a medical director when there was a motion to have Mr. Sykes, our director, be the health officer for the county. And, I know our had said that we typically do that, and that she was going to come up with a resolution, I guess, to submit to the county council
Yes.
for vote. My thing is why I said that, just so that it was clear, you know, by definition, the role of the medical director in the public health setting, is to provide medical expertise, develop and oversight and medical policies, represent the health department within the medical community, and participate in emergency preparedness. I know that we've done that in the past, but I think we need to look at, for that role, is the person, the medical director, the best person that we need to be looking at, to be that health officer. So I just wanted to clear that up. And then, the next comment. Was it where it said that, that I suggested that we have our own guidelines and not follow the CDC. And if you look above that, I believe our chairman made the statement. It's in some. That we must be careful as a department what we put out there, because we must follow the Department of Health and Senior Services and their guidelines and state statutes, which is true. And if you look at the hierarchy of the health departments at the federal level, both the CDC and the Division of Health and Human Services are both federal agencies. But the CDC sits underneath the Department of Health and Human Services. So that would be, you know, our current secretary, Robert F. Kennedy. So the CDC really answers to human services. So when that comment there, the way it looks like I'm basically wanting to go rogue and come up with our own guidelines rather than follow the CDC, like we really should be, as our chairman stated, following the director or the Department of Health and Safety. So I don't know, that appeared like I'm just wanting to come up with our own guidelines and not follow the CDC, which even in your words, Mr. Chairman, that we should be following the Department of Health and Human Services. So the way it's written, I don't agree with that.
Do you want that changed or,
However, we do it so that it reflects what my intentions were, saying that, not just come up with our own guidelines, like we should be following.
So I'll defer to you, but I don't know. I don't know if it was a verbatim or if this was what was actually said, or
And I
was
didn't
the
hear
interpretation of it. Well, it makes a difference on where this goes into, is what I'm saying. I mean, a clarification in these minutes from the last minutes is generally what I think would happen, correct? Because it's not a true, it's not like I voted. It's not like it's taken out of you know what I'm saying? It's not, the words were stated, correct? That's what I'm asking, I guess.
right, we don't, it's not.
So a clarification of what you said from last week is in this minutes, correct? That's
The
what-
minutes are, the minutes are correct because it's what was said. If you're basically saying that you want it noted in these minutes today, that you want to comment on those minutes, then that can be put in today's minutes, but the minutes from last month were taken down as it was said.
But they're not taken down word for word though, correct? I mean, it's,
Correct.
so maybe we need to
We
go
don't
back
have a
and look.
stenographer here taking what they do.
Right, and that's, I mean, it's kind of paraphrased, so I don't know that I said, you know. Cause it stated, Ms. Stidham suggested that we have our own guidelines on these issues rather than follow the CDC.
And that was correct. That is what you stated. And then Tim had talked about the state regulations. And
Right.
I think there may be some confusion as to the federal DHSS versus the state DHSS.
Okay,
So we follow the state DHSS, and those regulations say that they follow the CDC.
and then CDC is still under.
CDC
the
follows
Yes, the federal.
HHS.
I think they're voting, it's very. Did you, anything else on? All right. Still have a first and second on approval of the minutes. Are there any other questions? All in favor, please say aye. Aye. Any opposed? Motion carries. Next on is the approval of the May 2025 expenditures for $91,922.99. Do I have a motion, please?
Move to accept those expenditures, in the amount stated.
Do I have a second? Thank you. Having a first and second, is there any discussion on the matter?
Yes.
Go.
So,
Thank you. Well, I knew you were.
I know, it's like
You
by
already
the
told
time
me.
we get, there's
You
only
already told me.
48 hours and I've had,
I know.
my schedule is very
I know.
crazy.
You're good, you're good.
On 515, the oil change for the Ford Escape, was that on the 2017? Or was that on a different one?
Yeah, different one.
Okay,
We have more, like, we have
are there all this?
four
Ford
of the
Escapes.
17s.
And then that, I think that's all I have.
Any other questions or discussion points on the matter? So this is to approve the May 2025 expenditures for $91,922.99. All in favor, please say aye.
Aye.
Any opposed? Motion carries. Next on the agenda is the approval of the May 2025 electronic payments for $509,987.57. Do I have a motion?
I'll make a motion to approve.
Do I have a second?
A second.
Having a first and second, is there any discussion points? Go.
On the wind stream, I know I brought it up last time of the amount we're spending on communications and internet. So for May. In the wind stream, under the estimated amount, it's 31,400, we paid actually 16,682. So. On July, then it's only stated for the estimated amount for 15, was what the difference was from. May to July that,
Do you have that?
I have
Do I have an
an
answer,
that.
please?
okay.
Please come up to the podium, I'm sorry. Thank you.
The one on May, that person who had typed up this before. Thought they didn't pay the month before, so they were trying to add two together. Okay, that's not what happened. So, okay.
Okay. Any other questions?
One question about the expenditure. We're still paying for expenditures in Arnold, right, for the building in Arnold?
Yes,
So we're not selling it or anything, it's gonna be. For the utilities and all that.
right now, we're still there.
Still there, okay.
See the future, I think.
And on that one too, on that contract, High Ridge is still noted. That contract was from 2018.
Correct, because we had to get a whole new contract to take High Ridge off, even though we got rid of High Ridge.
So we don't pay that.
We're not.
Correct.
Do we have an updated contract then?
You
Well, I mean, it's updated that High Ridge is not being paid for, but we are gonna go and redo all of our, like we said
We'll
before.
bid it out.
Yeah, we're gonna go out for bid, but the way that it worked,
Okay.
it is easier to transition into the new building under this contract.
Fair enough.
I think it's we're set up where that's gonna.
Okay, great. That's all I have.
All right, so I'm gonna reiterate this again, this is for the May 2025 electronic payments, $590,987.57. Any other discussion points? All in favor, please say aye. Aye.
Aye.
Any opposed? Motion carries. Next is the pre-approval for the July 2025 electronic payments for an estimated amount of $648,276 and no pennies.
I'll make a motion to approve.
The motion, thank you, there's a second, first and second. Is there any discussion points? Not hearing any, all in favor, please say aye.
Aye.
Any opposed? Motion carries. Mr. Sykes, the floor is yours.
Okay, we get to it. Don't have a whole lot in my director's report. A little follow-up on grants and contracts, still nothing on the Title 10. What we did hear from the state regarding PEP funding, that's our public health emergency funding. That it will be cut in half from the money that they receive from the federal government. I believe, and you all can correct me, we're fine for this budget year. We're hoping at the end of the 6 months, the state had some hope that that funding will get reinstated. Because their funding model runs July through the end of June, so we'll be good for the end of this year. And then hopefully the next 6 months, maybe they'll reinstate it, but if not, we'll have to look at some things next year for Fed funding. And as far as that, the other grants and contracts, we're kind of in the same boat as we have been. We did meet on June 4th with our medical director, Dr. Goudreau, with Mercy. Several of us met with him. I think it went very well. We did get our standing orders. Although I think there was one that needed to be signed, it has to go back for him to sign. It just got overlooked, but he did get our standing orders, reviewed and signed. We discussed coming to a board, meeting the board. He was open to that. I'm thinking maybe we try a September board meeting. And if, I liked it to be more of an introduction of the board and him to each other. If we do have some questions for him, I think that he would prefer that those questions be sent ahead of time so he can do some review on that. So if anyone has questions, I would like to get those. You can email to me or Jetty and we will get them. And we will try very hard to get him come to September. He's no way he can make every board meeting. I said, I don't think that's an expectation. We know he's got a lot on his plate, but hopefully we can move forward with that. Some of the highlights that you'll see in the programs, reports that the others have put in, the surveillance program for mosquito has begun. That is our testing part of it, where we collect mosquitoes. And they run tests to see, checking for West Nile, things like that. So hopefully by next board meeting, we'll have some data to present on what we're seeing out in the community. I'm sure that the last few days, our trapping has been fairly significant. I haven't seen any numbers, but we'll see by next board meeting. Another thing I would like to highlight in our from the wellness report, clinical service report, that we have kind of a unique thing coming up at the Walgreens in Arnold. We've partnered with them. We'll have our wellness van there on this Friday. It's National HIV Testing Day. So we'll have our van on the parking lot there, providing STI testing on the parking lot. That's in cooperation with Walgreens. And so it's gonna be extremely hot. We're gonna see how well the van works on that day.
That's a new name.
Yeah, new van will be out there. So, I thought that was really neat. And there's some, read through those reports. I think it was, the wellness van did a visit. I thought that was interesting to a school and some of the questions that the kids asked. Did you read that? That was pretty good. They asked some pretty interesting questions.
How old were they?
Middle school.
Middle school.
Yeah,
Okay.
so that's my report that I have. Director's report.
Any questions for Steve? Any question on any of the reports inside? That's one thing. Would you start putting underneath this section, please, that make sure there's any questions that,
Yeah,
so it reminds me to ask that question.
that was something we did, yes.
So if there's anybody who wants to review any of the questions stuff in there. Okay. Next on the agenda is public comments. I think we have one person.
Liz Downer.
5 minutes. What do I get?
Do I need, well. Oh.
Well, I have to ask, because sometimes you give me 3, sometimes you give me 5.
Well, there's, I give you 5 when there's, it's only 3 when you.
I've been here by myself before, and I've got 3.
No.
Yeah. Just yes.
No. All right, I'm going the opposite way. Go ahead. You are Liz Downer?
I'm Liz Downer. I live in High Ridge. I live in Bell. I was like really in mixed emotions about what to talk about today because I have a heavy heart about a lot of stuff, as we all kind of do. But the children are what hurts me the most. Because I feel like they're a little bit under attack right now. And with our current vaccination schedules that we do, I mean, I think I heard latest, we were up to 92 injections by the time a person is 18 years old, and that's kind of crazy. So I have this book here. It's by Dr. Sherry Tenpenny, Zero Accountability in a Failed System, How Big Pharma Weaponizes Vaccines, Public Health, and the Law. A really good book. So I just want to read a little excerpt out of it on adjuvants, because I know last month I talked a little bit about the toxins, poisons that are in some of these injections. And so an adjuvant is described as any reaction, or vaccine clinical trials are primarily interested in 2 results. Any reaction or side effect, usually only monitored for 5 to 14 days of receiving the vaccine, and 2, the development of an adequate antibody response. If the number of reactions was acceptably low and the antibody level was found to be acceptably high, the vaccine is considered to be safe and effective. But there's a problem with this conclusion. For one, it can take much longer than 14 days to develop an autoimmune reaction or other type of side effect.
In fact, it can take months, sometimes many months, even years. So manufacturers conclude that the number of future severe reactions are so small that they are not statistically significant and not worth the time nor the money to study. The manufacturer, by the way. The second problem is the definition of effective used by clinical investigators. Clinicians and the general public interpret effective to be a synonym for protective. In other words, if a vaccine is determined to be effective, the person who receives it assumes they are protected from infection. However, in vaccine research, effective is defined as the vaccine's ability to induce an acceptably high antibody response called a titer. The assumption is that if titers are elevated, protection is assured. And it is also assumed that the higher the titer level, the greater the protection. This assumption has never been proven. In fact, the mainstream medical journal Vaccine published an article in 2001 clearly stating, it is known that in many instances, antigen-specific antibody titers do not correlate with protection. This means you can get a vaccine, develop an antibody response, and still contract the infection you are trying to avoid. In addition, you assume all the risks that come with being injected with the toxic solutions. So I don't know if you guys are familiar with the story, the Lorax, Dr. Seuss. Okay, so what does the Lorax say? Lorax says that I am the Lorax, I speak for the trees. I speak for the trees because the trees have no tongues. What are we? We have to speak for the children. Okay, there's a really good quote that I found by Dr. Andrew Weil. And he said, we must continue, he said, no matter how difficult the road, no matter how serious the consequences, we must fight for these children. Because if we put down the flag and surrender when the going gets a little tough, who else will do it? Who will dare pick up the torch and carry it forward if we quit? There will be no one, not one. And the next generation of children and the next will be lost forever. These toxins are everywhere. I know you guys feel it. We live in a toxic world, our food, our air, our water, energy, EMFs, the frequencies. So where do we start to even begin to repair the damage? I begin with God and I pray. I have for you guys, our HHS director, Robert Kennedy Jr. has put together the MAHA report. The contents, he's got a plan, okay? There you go, give me all my time. So the study, the scope of childhood chronic diseases, wants to advise and assist the president on informing the American people regarding the childhood chronic disease. And it wants to provide to the president government wide recommendations on policy and strategies. So this was written in February 13th, 2025. Okay, so he said within 100 days of the order, he will have Make Our Children Healthy Again assessment. Mr. Sykes, for you, I have for you, as our health director, a copy of the MAHA report, and I also have a copy of the MAHA report, Making Our Children Healthy Again assessment.
Thank you, Michelle.
I asked that you could, this would be your homework, and maybe add this to your report.
I think you've already reviewed some of that. I know you have.
Well,
Thank you very much.
and there is no charge for copies. Thank you.
Thank you.
Next on there is, I'm sorry, there wasn't anybody else, right? But I'm check before I move on. New building updates.
Okay. So we're continuing to work on the furniture installation, waiting on some furniture that did not come in. Trying to correct a couple of things that were installed wrong, but it's pretty much fully furnished right now, just a few things here and there, and it looks really, really nice. Again, our wayfinding signs are all installed. We did another walkthrough yesterday, with some punch list items. I think we have a really good plan. A lot of them have been corrected. There's some things they're still working on. Trying to get their people back in to correct some of the items. A lot of it was some of our IT security cameras still needing to get adjusted properly. Our badge pass system for the doors, all of that needing to get that fine tuned and ready to go. One very good positive thing that we were all kind of worried about is our vital record system is up and working out of that new building. That was a lot of work that Mr. Ferry put in on that to get that going. We had to coordinate with the state, and that was a difficult task, so I appreciate that. The building alarm should be installed now and functioning. We feel in the vaccine temperature monitoring system, so things are coming together as far as the fine tuning. We've coordinated the move. We're ready to go on July 7th and 8th is when we're planning on doing our move. So, that should be as smooth as can be, no problems.
You put that out there? We went.
The other thing is, if you have time to drive by, the landscaping is pretty much done. They have sod in it. I never realized how much that changes the look of a building, but it does. Our main sign just pops.
Is it sprinklers?
Sprinklers work.
Okay, this is gonna
I was
die.
He was there adjusting it on Tuesday.
Yeah, if you haven't been by to see the great, I mean, it really does make it, it's really amazing.
Those guys were laying the sod this week. It's heat. They were out there all day putting that sod down. It really, the building looks very good, both inside and outside. We're gonna work.
So that reminds me while we're on this, we're all gonna see an uptick as maintenance on the building, because grass cutting is gonna cost us more, just be aware.
Yeah, we're thinking about it down the road after we get in there. We may look at some of that on the hillside, doing something more with native grass.
I
But
thought you were gonna get some goats or something.
no, Plant B there, but you know, we may have should have done that at the beginning, but you know, but I think doing some native grasses on that hillside may look pretty.
Turn into
nice.
Those are rocks.
pollinator garden too.
Yeah. Yeah,
All right,
so,
anything else you got going?
we did have begun some of the training, on the HV, heating and cooling. Which it's no longer just a little knob that you turn to make it hot or cold. It's a whole process, and Steve and I and Steve sat in on that. It's significant. We were also trained on the generator as well. I kept the update of, our schedule of our dates to move, into the facility and then when we will be open. I think as far as I see, I believe we're gonna hit our dates. Couple little more things I have to provide to the city for our occupancy, but we should be fine on that. We're gonna present some of the finances there on the building as well, so. If you have time, just drive by our sign. I think we did a really good job on the placement of that sign. It really looks nice. Any questions on the building?
Did we have a set date for ribbon cutting or we're waiting on that? We're waiting,
Unfortunately, the way things have gone,
we're waiting, so.
it's gonna look kind of awkward because of our June plaque. dedication. But we're looking, we may do it in September, because August, everything is so busy.
With all the kids going to school and stuff.
Yeah, so we're looking at September to do it all.
Okay.
So, and we're gonna make it a dedication open house type.
All right,
So we're just gonna have one open house,
I think that's the plan, just do it all in one.
and it'd be in September.
That's where we're looking at, yeah, we don't have the exact date. We have some vacations. I think once we get moved in, people are taking a breath and doing some things, so. But,
all right, well, we'll figure it out.
yeah,
All right.
yeah.
So we're gonna move on to new business. I know there's a policy change. Personnel Committee, the recommendation to approve the Jefferson County Health Center Employee Policy and Procedure and Operations Manual. Before we have discussion, can I have a first, motion to approve? For the Personnel Committee, the Employee Policy and Procedure Operations Manual. So I,
Make a motion, we approve.
who was a second?
Second.
Second, Dennis or Amber, do you guys want to talk about that, or Steve, who wants to? Who wants to talk about?
Personnel committee reviewed it and we did. I don't want to speak for Amber, but I don't believe we saw anything that looked to be a problem, and I know any changes were made in consultation with our attorney, so I think as far as we're concerned, everything looks good.
I agree.
Will this be a single read or a two read?
Is the paragraph in the. Like, would you be sending a paragraph, I have like, which means the zone fire,
Like you.
that was up today.
Yes.
There's nothing major change to it, if you have any questions about what was on the flyer. They had the updates,
Is everything, the manual, everything else is the same, these are just the updates that will be put in.
Like some of
And
the
the change.
changes were like things that were already in the bylaws that we put into the policy, updated. We updated every 2 years, so.
it's not a resolution, so it doesn't require a second read, but there's nothing to.
And this is
if people
really
want a second
the
read.
oversight and overview of staff, correct?
Correct, yeah.
Okay.
And once it's approved, we will train the staff on the original check.
Is there any questions on the document whatsoever? I didn't see anything to that either, but. Otherwise. We have a first and second to approve the updates.
Can I add one thing? We'll change the name of cost of living increase to be called an annual raise. If money's not available for that in a given year, is that a problem or?
No, so actually, it's more of a problem if you continue to call it COLA, because COLA is based on the CPI, so. This gives you more flexibility to either go above COLA or below COLA, depending on the availability of funds.
And we still have that statement in there that it's a availability of funds.
Right. Okay, thank you.
Right. Any other questions? So again, this is to approve the updates that you have in front of you for the policy and operations manual of the health department. Roll call, please.
Mr. Big,
Yes.
Dr. Henry,
Yes.
Ms. Stella,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
Motion carries. Thank you very much. Next on the new business is approval finally of the quitclaim deed for 405 Main Street, Hillsborough, Missouri, 63050. And I believe this is authorizing me to accept and sign the document.
To execute both documents
Execute both
and the consideration is $1 for each,
So we're doing each one of these individual or,
you can do them individually.
okay. So some $1 so for those who didn't know, there was a lot of questions on the ownership of the building and back and forth and deeds. They were pretty messed up and I do think Christie and her staff and her folks have helped them getting this straightened out. Said there was a lot of document digging and going in. It was pretty crazy. So this is for approve to accept the quitclaim deed for this site, 405 Main Street, Hillsborough, Missouri. Do I have a first?
I'll make a motion.
Do I have a second?
I have a second.
Is there any other discussion points on that matter?
Just curious why they call it quit.
Quit, yeah, it's
Because
called
they're quitting their claim to
Yeah.
the deed.
it's a strange way.
And, you know, previously the street here was Second Street and it was changed to Main Street. So does that, is that a problem?
It's got the verbiage from the current deed that's on file with the recorder's office.
Okay.
So when they re-record, will they update? Cause we gotta that was re-recorded, right?
It's got to be recorded, yes.
Will it change that, or is that necessary?
It's based on what's on the current deed, which is Main Street.
Oh, it is.
Okay, any other questions?
I'd say hats off to Dennis and a lawyer for getting it on. There was a headache. I'll make a motion that.
We've already got a motion. We've already got that. We're gonna go ahead and vote now. Roll call, please.
Mr. Big,
Yes.
Dr. Henry,
Ready?
Dr. Henry.
Is everybody?
Yes.
Ms. Stidham.
Yes.
Mr. Deal.
Yeah.
Ms. Taylor.
Yes.
Okay, and we'll look for the approval of the quitclaim deed for the 1818 Longdale location in Arnold, Missouri. Do I have a first for that?
Make a motion to accept it.
Do I have a second?
Okay.
Having a first, second, is there any discussion points on this one? Not hearing any, roll call vote, please.
Mr. Peg,
Yes.
Dr. Henry,
Yes.
Ms. Stidham,
Yes.
Mr. Deal,
Yes.
Ms. Taylor.
Yes.
All right. Next is the September. Guess somebody can't be there, so we're looking to change the date for the September board meeting date. I know it's the, so I don't, what date is it supposed to be?
Fifth, isn't it?
20,
Yes,
For
it's
September?
supposed to be September 25th.
Oh, that's okay. Right.
I don't,
Could we do the 29th or 30th on Monday or Tuesday?
Mondays always work for me. so-
Me too.
What about
30th?
30th is good. Sorry.
September 30th.
On a Tuesday.
Tuesday.
That's the 30th. That's,
Does that work for you, Denise?
Yeah.
How
I
about
know
that?
it's underlined, but I don't think we really need to vote on it, do we? Just a
No,
consensus
you
is
have
good
the
enough,
ability to set the date.
just consensus.
I'll update the meeting invite.
Okay, so in your,
I'll resend it.
yeah, send it out, please. So in your packet, I do have, and I apologize for not getting it out sooner. But life does happen. So, I didn't change any of the committees. If anybody wants to change, or says, look, I really don't want to be on that committee, then change something else. Just send me an email and we'll see what we can work out to do. Same thing on the visitations. I just kind of rotated it down and put it to where the couple of people that I missed, and trust me, I'm here every month, but so if you feel that you can't make one, just let me know. It's not a really big deal, but make sure that you contact Steve and let him know so we can schedule a time for you to get out of here, just so there's nothing. Well, I guess it's gonna be in the new part here shortly, but so he has time and he can schedule around with meetings and so forth. So if we can do that, that would be great. If you have any questions, again, if you want to trade with somebody or ask, hey, can I trade? I'm gonna be really busy in whatever month, let me know, we'll trade out. It's easy enough. Next is entertain topics for our next agenda. Our trustees. Do we have anybody looking to have topics? Need a second for that topic to be placed on the agenda?
I don't have a topic, but I don't know if I would bring it to the board that I wanted to donate adult coloring books to the health department, no, I want to just bring them.
Just give Steve and or Jetty and drop them in their hands for that. That's,
For mental health, they're mental health type, so.
Right.
So,
can you show that?
okay.
It'll go with
my marker
Monday.
There you go. Just for you.
Not hearing anything else, we're gonna move on, since we're a little time going to closed session. I think there's just a little bit to discuss. And approval of the May 22nd, 2025 closed session meeting minutes. So do I have a motion to go in the closed session?
I'm motion to go to closed session.
Second? Second?
I'll say.
A second is pursuant to 610.021, confidential and privileged communication between the Board of Trustees and its representative attorney and records that are protected by disclosure by law. Roll call.
Mr. Big,
Yes.
Dr. Henry,
Yes.
Ms. Stidham.
Yes.
Mr. Deal,
Yeah.
Ms. Taylor.
Yes.
All right. Thank you, folks. There will no be reason to come back. No reasons. So we will not come back live. There will be nothing to report out.